Hello, welcome back to the Practice Nurse Mentor. I'm Alicia. Thanks so much for joining me once again. So in my previous video, I talked about what is practice nursing and gave a bit of an overview on where that fits into the primary healthcare framework. And I also briefly touched on some of the tasks or skills or types of things that we would do on a day-to-day basis in general practice. After I did that video, I kind of thought about a few extra things afterwards. So I just thought that I would do a part 2 and cover those things here for you today. So this video is going to talk a little bit more about the pros and cons, I suppose. So some of the really good things about practice nursing and some of the perhaps less good things. I wouldn't call it negative, but there's definitely some things to consider. If you are thinking about a career in general practice, if you're thinking of moving from hospital-based nursing or some other form of nursing and taking on a general practice role, then this video will be quite helpful, I think. So in terms of the pros or some advantages of working in general practice, probably the most desirable and often one of the main reasons I think that people want to get into general practice nursing is the princess hours. So the daytime hours, no shift work, sometimes no weekends, depending on the practice. Some practices do open on a Saturday morning. Some practices also may work into early hours of the evening. But generally speaking, most practice nurses will work from, say, 8 in the morning through till 4:30, 5 o'clock, something like that. So we have predominantly daytime hours, predominantly family-friendly working hours, and helps to promote that work-life balance for people. It tends to fit in really well with mothers of young children, with school-age children. That kind of stuff tends to be one of the things that works really well for nurses working in general practice. And so, yeah, that work-life balance is really there. You tend to have the weekends to yourself. You have your nights to yourself. 95% of the time, I think most practices have that kind of hour, those kinds of hours. Another advantage, I think, is that we do tend to develop a pretty broad range of skills as a nurse. There's lots of opportunity for upskilling. I'll talk a little bit later on in this video about some of the elements of ongoing training that is desirable, I suppose, for a practice nurse. So we tend to be really broad across a whole range of different aspects of nursing, and there's a lot of different skills that we take on in order to have a more fulfilling role in that general practice setting. We can also specialize a little bit as well. So some nurses will, skew towards specific aspects. So maybe diabetes or wound care, may then go on to being a nurse practitioner or something like that. So it can be really fulfilling to sort of really get your teeth into a whole bunch of different ongoing learning. There's always something else to add in to your repertoire as a practice nurse. So I think that's a really positive aspect to this job as well. Sometimes if you're working in the wards on the hospital, you tend to get sort of stuck in that little niche, whatever that ward is, if it's the gastroenterology ward or the cardiac ward or general medicine, post-op surgical type stuff. You tend to kind of get stuck in that mold, and you kind of just sort of sitting and spinning your wheels a little bit in those areas, whereas general practice, you don't tend to do that too much. There's also a fair bit of, flexibility. There's autonomy there. It's very collaborative, so the nurse works really well and in close collaboration with the GPs. So it's the clinical team is usually very cohesive, working together. But there is also that little bit of flexibility around the kinds of things that you're doing in general practice. So you might have some days where you're focusing on chronic disease stuff and health assessments and stuff like that. And then other times you'll be doing more general nursing, treatment room stuff. I think that having that kind of work-life balance hours also sort of prompts that flexibility a little bit more as well. And yeah, we often do get to make a lot more decisions for ourselves. We don't always have to defer to the doctors. We don't always have to be waiting for the doctor to give us advice on what to do about something. A lot of the time, when we have that good developed relationship with our doctors and other clinical members, we can make some decisions a lot more for ourselves and determine how things are going, especially things like wound care. Quite often the doctors will defer to the nurses because we tend to be the ones that have more of the ongoing training and more current information. So I really like that aspect of it as well. So we do get treated like a healthcare professional, which is what I really like. There's also quite a diverse range of job opportunities as a general practice nurse. So I think I mentioned in the first video, you can work all over the country. You can work in rural and remote areas. You can do fly in, fly out. You can be doing community stuff. You can be working in corporate areas. I know nurses that work up in the mines and do health related tasks in that area. Where else? You could go and work on a cruise ship as a nurse. You could go and do so many different jobs as a primary healthcare nurse. So in addition to things like working in a specialist centre, so working for more specialised practices. So yeah, there's a huge range of diversity and job opportunity as a general practice nurse or primary healthcare nurse. Some of the probably downside, the cons, would probably be the most common one would probably be the pay disparity. So not really quite sure why we have such a big gap with pay, and it can vary so much from practice to practice, which is really sad. Yes, there's a base pay rate or the award, which that's the minimum. But I think it comes up with definitely, well, obviously we don't get any penalty rates and we don't have any shift loadings and all of that kind of stuff, which you normally would in a hospital if you're working those shift hours. So you do lose that. That's the downside of having that work-life balance, of having those princess hours, is unfortunately you don't get to live like a queen. The problem is that it's a bit open to interpretation, I guess, with some practices that if you've been into the hospital setting and then you come and work in a general practice setting, you are starting back at the base level because of your lack of experience. When you look at the pay, when you look at the award, the wording of the award, it comes down to that level of experience. And when you first come into general practice, you don't have the experience. And so that's when they put you back down to that first rung and you have to start from the bottom and work your way back up again. There is a lot of negotiation that comes on board as you start developing your skills, as you start doing extra learning and all of that kind of thing. You then have that ability to negotiate a bit more with your employer, and then you'll start seeing the higher pay rate. So initially, you're going to have to take a pay cut, and that's where I think most people find it the hardest. So that's something to really bear in mind if you're considering coming over into general practice. Some employers do provide some additional remuneration, so they might pay for you to do courses and training, which is brilliant if they will do that for you, especially if it's what they want you to be doing for your work. So if they want you to be going and learning how to do cervical screening, it's only right that they pay for the course for you. So whilst your pay rate in your bank account every fortnight may not be as high as if you're working in a hospital, sometimes there are other perks to the job. like having those paid training things. Something else I really noticed as well is I think that there's a little bit of limited industry support. For example, like with unions, we don't tend to get the same level of support as what hospital-based nursing does. Again, don't ask me why. We do have APNA, which is the Australian Practice Nurse Association, or Primary Healthcare Nurse Association, I should say, to be more specific. And there are some other networks around that do support nurses. There's some forums online on Facebook and things like that that you can be a part of. The Australian College of Nursing, those sorts of things. So we do have some areas of support and networks for us, but if you're looking for things like union support and those kinds of things, we don't tend to seem to have that very strongly in general practice nursing. So unfortunately, some practice nurses do have difficulties in their workplace, as most other places. You know, you can have problems working at McDonald's, you can have problems working at Woolworths, you can have problems working at the business down the road. Nursing is no different in that respect. So, but unfortunately, the union support often isn't there. Probably another thing sort of similar to that is that we do tend to work in a much smaller, insular environment with each other. In general practice, it's very... if you don't have the right team, if you don't have the right personalities, it can be hard going if there's people that don't fit in into that workspace. So I hear it a lot when I'm doing mentoring with nurses, especially nurses new to general practice, that it's very challenging sometimes to fit into those little cliquey areas. It's not like when you're in a bigger hospital where you may have a big rotation of different nurses on the ward. You're with the same people day after day, week after week. So it can be a little bit challenging to find the right workplace for you. I've certainly had experience in my life with working in practices where it didn't quite gel, didn't quite fit in. And then I've got other examples where I've had amazing work teams, and it's been an amazing time to work in general practice and spent several years at the same place because the work environment was really good. And I'm fortunate to say I have a great work environment where I am now. So so that can be a little bit of a downside, and there's no shame in going and trying a workplace, and if it doesn't feel like the right fit for you, then move on and find somewhere else. Don't just give up on working in general practice, because there's lots of really good places out there, and every team is different. Some other points to mention, which are probably a bit more neutral, they're neither a pro nor a con, I don't think, is that there is a lot of like digital technology involved with the job. So if you're someone who's not as tech savvy, not overly familiar with software systems, that kind of stuff, then you may find it a little bit harder to get going. Once you get going, you're right, it's just wrapping your head around all of the technology that's involved with the medical side of things. And then likewise with Medicare, working a lot with it, Medicare billing, item numbers, coding, that kind of stuff can be pretty hard to get your head around, because it's such a big difference to something that you've ever learnt or ever done when you've been working in the hospital system. So yeah, that's probably a thing that I do find nurses new to general practice can sometimes find it a bit challenging. But as I said, once you get your head around it, then it's pretty good. And just be, I guess, mindful that that's the kinds of things that you will be expected to do a lot in your day-to-day job. So if you're still keen to come and work in general practice, I hope you are. Then I thought I would also just talk about some of the most sort of desirable things that we're looking for when you are going for a job interview. So we're looking for people who have these kinds of qualities or are keen to develop these kinds of qualities. So because you're going to be working really closely with people, whether it's your colleagues or your clients, patients, then obviously you're going to have really strong communication skills. And this is really important because this is going to be every day, whether it's your other GPs, other allied health professionals, the patients, their families. You're seeing them sometimes when they're not at their best. So yeah, having some good communication skills is really important, and that's face-to-face and over the phone and written skills, that kind of thing. You need to be able to work independently as well as part of the team. Yes, you're going to be doing a lot of stuff on your own in the treatment room, doing care planning, all of that kind of thing. But it's really important to help get that teamwork going as well. That saying, teamwork makes the dream work. So if you want to really foster that great workplace, then teamwork is the go. As I said, being a bit tech savvy and willing to learn the systems, and if you're quick to learn, then you'll be okay. And also be keen to really be focused on that evidence-based practice, evidence-based nursing, with whatever the skills, whether it's wound care, injections, medications, immunizations, all that sort of stuff. Staying on the top of everything is really, really important. And things can change pretty quickly with some of these things. Some things take a while. So being willing to be up to date and current with as much of your healthcare is really important. Wound care is huge in general practice, whether it's acute stuff, injuries, surgical. We were doing a lot of post-operative type things. We have general wounds. Someone's cut themselves, fallen over, got skin tears. That's a big one. But we also have, slow to heal wounds, ulcers, peripheral vascular disease, cardiac issues, so they've got edema, all that sort of thing. So from the basic right through to the complex, getting your head around wound care, that's something that's really desirable to have those skills in general practice and be willing to develop them. Even if you've got the basics, willing to go and do the extra training to brush up on your wound care is really desirable. Some other tasks that we would do is like earwax removal. So some places have irrigation, some places have microsuction. So having that skill, being willing to go get that skill is really important. Being an accredited nurse immunizer, it's not an essential, but I think it's a really important aspect. Yes, being an accredited nurse immunizer means that you can technically immunize without a doctor giving you the order to do so. When it comes to the billing side of things, that might be a little bit different depending on the practice. You can also go and work off site in other job roles if you're an independent immunizer. Great. The one thing I really love about doing the course and the training in it is that you become very, very familiar with the national immunisation programs. So this is going to be the bread and butter of immunisation stuff. This is the holy grail of it all. So I like that aspect of when you've done that training, you're very familiar with it. So that's really good. Cervical screening, as I've mentioned before, being able to do that, being willing to go do the education on that, and women's health in general would be amazing to have those qualities. As I said before in our previous video, doing ECGs and spirometry, there's courses available to go and master your skills in those areas. As well as things like diabetic care. That's a massive one in general practice, understanding what someone's cycle of care is all about and the different ways that a nurse can support that person to make sure that their diabetes is well managed. So there's often courses available to go and brush up on your skills and your knowledge of helping to manage someone with diabetes. So if you're applying for a job as a practice nurse and you've got no experience, what can, and as I said, you're obviously willing to go and do some extra training to learn some of these things that I've just talked about. A couple of big things that we'd be looking for is enthusiasm is a really big one. So for that whole principles of primary healthcare nursing, for practice nursing, for looking after people, that holistic care, being enthusiastic about that, and that willingness to learn and undertake the studies and the training to learn those skills, that's a big foot in the door for me. Adapting your current skills. So if you're transferring from hospital to general practice setting, thinking about how you can transfer some of those skills that you have into the new role, and being willing to talk about that with your interviewer, that this is what you feel confident in your abilities and your skills and why you think that you could transfer these over. Being good with technology, as I said before, and being flexible and available. I know when I've held interviews in the past with putting on nursing staff or other staff, and you've put in the ad that you want someone available Mondays, Wednesdays and Fridays, hopefully between these hours, and then they come into the interview, oh, but I'm only available on Thursdays. No. If we want you on these certain days, these are the days that we want you. Not the days that suit you, it's the days that suit our practice. So if you're flexible and you're able to be available to us on the days that we need you, when the DPs are there, then that goes a long way with people who are trying to hire you. I think I've covered everything I had, all my afterthoughts that I had from the previous video. I think I've covered them. If you have any other questions, please feel free to pop them in the comment section and I will absolutely address them for you. Please feel free to pop up some suggestions as well about what kind of content you would like me to make videos of, and I will add that to my list. But for now, I think that's it. I hope this has been giving you some extra information about what it means to be a practice nurse, and if you are thinking about a career in practice nursing, I hope the information will help you to do that. So good luck. Bye.